Reentry Initiative, and we're going to introduce them as follows. Mr. Charles Wilcox is our Superintendent Warden of Coastal Transitional Center. Amen. We thank you for coming and sharing. Mr. Joe Cafaro, amen, serves as our Chief Probation Officer. Ms. Paula O'Neill serves as our Chief Parole Officer, and Dr. Maxine Bryant serves as the Community Co-Chair. Okay, and she's on her way. And these individuals that have been sharing in this initiative, we're going to go over a brief overview of this initiative, and then we're going to introduce our special guest. And this initiative, you will see in your packet, serves not as another agency, but as an attempt to collaborate particular service providers that are already providing resources, as well as partnering with probation and parole, that those persons who are at high risk and high need would have a more successful opportunity within our community. Our office of the Governor's Office of Transition Support and Reentry is led by Jay Neal, who serves as the Executive Director. Bob Keller serves as our Deputy Director. Renee Sneed serves as our Administrator. Evelyn Armour as our Service Coordinator, Executive Assistant, and Anita D. Cloud, Faith and Community Partnership Coordinator, as well as the Savannah Region representative. Some of you have already been part of the stakeholder meetings that were on the state level, and so now, as we are now attempting to implement this plan on a local level, we want to take this opportunity to share what we're going to be doing on today. I'm going to give a brief overview of the Georgia Prisoner Reentry Initiative, and then I'm going to have an opportunity to share with you some examples of our community assessments for Reentry Coalition development that we've done. We're also going to present to us, and again, we're grateful to have Mrs. Arlene Davis, who's the Executive Director of the Housing Authority of Savannah, and she's going to share with us our federal guidelines and her collaboration with the GAPRI. We're going to have an attempt to do some small breakout where you're sitting as we continuously to review, brainstorm, and service providers that we have not yet assessed that are that provide services to returning citizens, as well as proposal solutions to gaps and barriers. And we'll have a report back and making the connections, linkages, partnerships, and strategies. And of course, you could not come here and not have something to eat. So that is very important as well. So we're going to move expeditiously through this brief presentation. We want to take this moment to understand the cost of failure here in the state of Georgia. That within the state of Georgia, for our prisons, camps, and our facilities for incarceration, we currently are now spending $1.2 billion to operate over 80 facilities within the state of Georgia. Next to the education budget, this is the largest budget within our state. It is interesting to note that we are the 10th largest state in the nation, but we're hovering around the 4th and 5th largest prison population within the nation, which is next to the state of New York. And at a rate of 18,000 annually per inmate, we're investing in the lives of persons who are doing anywhere from 3 to max out lifetime sentences, as well as dealing with individuals who have chronic illnesses. And our recidivism rate statewide is only 27%. So therefore, we're saying that 1 in 13 adults in Georgia are under some type of correctional supervision versus 1 in 31 nationwide. And so this is an attempt to begin to bring these rates below the average, and attempt to provide our society with the tools necessary to reduce crime, but at the same time to make sure that our returning citizens have a higher success rate of being able to connect with housing as well as employment. Within this statewide plan, Governor Deal in July of 2013, created the Governor's Office of Transition Support and Reentry. And this office has the task of piloting 6 sites throughout the state of Georgia, along with Savannah, Albany, Columbus, Macon, Augusta, as well as the Atlanta-Fulton County area are currently one of the pilot sites that are going forth as we speak. The GAPRI focuses on prisoners who are already eligible for release based on Georgia law. So therefore, this is not an early release program. This is simply a program to be able to share resources and to collaborate with community agencies as well as other stakeholders to provide individuals a better opportunity at success without having and being an early release program. And returning citizens are typically released back to their home counties, stating that the individuals that we will be servicing are individuals are coming back to their point of origin. As you look in your packet as well, you'll be able to see the risk and needs for the Georgia Prisoner Reentry Initiative. That this gives you at least a breakdown from 2014 to 2015, and again, this is simply an estimate of where we are and what has been assessed thus far. That when you deal with needs from criminogenic thinking backgrounds to substance abuse to education and employment, individuals that have currently already been assessed, you will see where we fall in as well as low, medium, and high rates. So this is based off of a number of 513. Again, this is a number that is just simply an estimate, but gives us a better understanding of the type of needs that our returning citizens will face. Now, under the Georgia Prisoner Reentry Initiative, we are focusing on medium to high risk needs as well as risk. So when we take an opportunity to look at, for instance, the area of education, for individuals that are returning into the state of Chatham, again, we're looking at about 80% of individuals who currently have some type of formal educational background. When you look at medium, 54.7%, and high, 29.1%. And so, therefore, as we are attempting to assess educational needs, we fall under and realize that our employment rate for individuals who are stating as they're coming out that they are prepared to walk into some type of employment for high, that 32% are prepared to do that, and those that are at medium risk and need is at 55.7%. We also are understanding that when we deal with criminal thinking, which is cognitive restructuring, as you deal with criminogenic background of the mind, that we're looking at 37.8% medium and 47% high. For peer groups, individuals that desire, that need mentoring, which mainly comes a lot from our faith-based community, 49% is at a medium, and high is at 41.5%. These statistics give us our opportunity to how we can better direct our resources to those that fall under medium to high risk and high need. So therefore, the GAPRI local model, that these reentry services will be targeted for returning citizens classified as medium-high risk of reoffending. So the goal is that as we are collaborating with our very agencies and our community service providers, our faith-based groups, as we're building bridges with pardons, the Board of Pardons and Parole, as well as probation, as well as building bridges with our transition center, that our goal is to focus and to show that when we focus on medium and high risk and high need individuals, that they have the greatest impact on crime reduction. So we're not a new service agency. Again, we're simply attempting to collaborate our resources and bring them together, and that we no longer have so much of a duplication of services. And so the GRPRI will do these following bullet points. Act as an access point for referrals. Part of the GAPRI model is the steering team, which is normally scheduled at this time every second Tuesday in the month, and the steering team is comprised of individuals from various service agencies, as well as those persons that are part of our law enforcement, city officials, and other faith-based organizations, and that as we look at this model for community supervision, that we're providing coordination and support to agencies currently serving returning prisoners. And also to advocate on the local, state, and federal level to eliminate barriers and fill gaps in services needed for returning citizens to successfully reenter our community. The GAR-PRI local plan is that we also will provide comprehensive case management services for every returning citizen. Now, as they are being case managed by probation and parole, that steering team, along with the transition team, which is community-based, will also provide community-based case management as well. And one of the main goals is a seamless transition of engagement upon release, that as they are returning back into the community from first day services, to making sure that appointments are filled with mental health, substance abuse, to making sure that they have vouchers that are necessary for transportation, that we're focusing on those needs. And all of those needs are activities that are based on assessed needs, which are part of our responsibility is providing in-reach within the coastal prison system, which the new warden of the coastal prison is here. If you could stand. Let's give him hand praise. He's welcome. He's Vandy, Mr. Morales, along with Mr. Wilcox, that we're also will be doing in-reach, assessing the needs as well through their transition accountability plans, as well as providing referrals to existing resources. The local plan continued. So part of what the steering team and transition team will be sharing with will be supervised transitional housing, permanent housing referrals, employment services, mentoring and placements, family reunification and education, ID and transportation assistance, substance abuse and mental health services, and local law enforcement contact. Again, as I stated, many of your agencies and many of you are doing wonderful and outstanding jobs in providing many of these services. So what we're doing is making sure that we're connecting all of the dots that are necessary for our returning citizens. Now, as we have been given the task to assess our community service providers and the areas of service, as we've been looking for meeting the needs of returning citizens who are at medium and high risk, we have the areas of services have been included everywhere from first day out services that mean immediately upon their release that they're able to receive toiletries and necessary personal items, clothing, job development and supportive employment, income supports, cognitive restructuring, healthcare services, substance abuse treatment, mental health services, family support services, mentoring services, adult education, victim services, which includes advocacy, domestic violence services, law enforcement, meet and greet, as well as sex offender services. All right, the rain is coming. You have, someone has left their windows down, PD 3505, GMC Envoy. The rain is coming. All right, GMC Envoy, if you have, yes, yeah, thank you. Yeah, in the first parking lot, okay? Thank you, yeah, anyone? All right, thank you. Going once, going twice. All right, areas of service. For our areas of service, also, so far, these are the service providers that we've had an opportunity to assess. Within these community service providers, we've assessed so far the Inner City Night Shelter, Georgia Vocational Rehabilitation Agency, the Department of Family and Children Services, Office of Family Independence, Savannah Impact Program, Chatham County Safety Net Planning Council, which includes our healthcare services, Recovery Place, Savannah Counseling, Equal Opportunity Authority, the Fatherhood Initiative, Royce Learning Center, Victim Services, Rape Crisis Center, Savannah Baptist Center, Housing Authority of Savannah, the Chatham-Savannah Authority for the Homeless, the Hallelujah House, the Chestina House, Step Up Savannah Incorporated, Chatham Apprentice Program, the Salvation Army, Georgia Legal Services, as well as Goodwill Services. So many of you, again, may be part of organizations and community service providers that have not yet been assessed. Part of your packet, you will see a community assessment form. that individuals here will be able and be more than gladly to connect with you so we can get your agency assessed. That these assessments provide the steering team an ample opportunity to prepare for a transition team of the community service providers that will be providing the service deliverables that was on the preceding screen. Now, to give you an example of what our community assessment form has been, that the Community Assessment for Reentry Coalition Development, these are the areas that we have attempted to assess in some of our community service agencies. First of all, looking at the assets which are the strengths that are present in communities and may consist of program services, delivery systems, organizational capacities, and networks. That many organizations provide services to all returning citizens. And so we are attempting to make sure that we have a one-stop shop within a comprehensive plan in knowing who is providing what services and what their capacity levels are. Now, also within those assessments, we're looking at barriers. Barriers include but are not limited to the challenges that impede the effective coordination of being able to deliver these goods and services to individuals that are returning citizens. From our barriers, we look at our gaps as well. Our gaps refers to the absence of a specific element or component within a community that renders the service delivery network less effective than it might be otherwise. It may be something that could be addressed through policy, it could be something that can be addressed through organizational structure or funding assistance. Also, we look at proposed solutions. And those proposed solutions should describe the plan to effectively use our assets, fill in the gaps, and overcome the barriers for each particular service area. So as we are taking an opportunity to assess the needs, this is an example. Again, we have with us Ms. Stephanie. If you could wave your hand. Ms. Stephanie serves as the Executive Director of the Savannah Baptist Center. And the Savannah Baptist Center provides, for many things, what we would consider also first day out services, which is food, clothing, identification documents, transportation, phone, and hygiene kits. And we take an opportunity to look at the description of the asset. Savannah Baptist Center exists to glorify God by meeting the spiritual, emotional, and physical needs of the poor and needy. The longevity, they were founded in 1956, so they serve as one of our older organizations that have been providing services, and they have been in their current location since '97. And their funding is provided through local church grants and individual donations. Now, their capacity, from my understanding, that as they are looking at, they're able to service 50 men twice a week and 25 women. And they currently have no waiting list or client turnovers. The correctional population is included within the clients that they serve. They do not separate the returning citizens from the general population of the least, the left out, the lost, and the last. And programs can serve numbers that depend on donations and volunteers. So it also gives a brief overview of the history and the cost of their services. That currently the Savannah Baptist Center, because of their donations, there are no costs for services rendered or received if homeless, and others have a homeless certification. Without certification, $1 is used for laundry and showers. Eligibility for them, homeless certification for free shower and laundry facilities, small charge $1 without certification. Transportation, the Baptist Center has a bus and a van. Needed salary assistance for driver and fuel. And their referral process, that referral process is only for the food pantry, correct, Ms. Stephanie? Mm-hmm. And other agencies and individuals refer clients to seek assistance, but however, referrals are not necessary for participation. And to access the Savannah Baptist Center, that they are on close proximity to the shelters and homeless camps and public transportation. Barriers include no transportation or housing provided. So then we would take this moment to look at what some of the barriers would be for the Savannah Baptist Center. Barriers are looking at in assessing services provided by the Savannah Baptist Center. Transportation has been a major barrier. In meeting the needs of the current populace, the center is unable to provide any type of transitional or permanent housing, correct? And so that could be a barrier as we're attempting to expand our housing piece here. For gaps, Current gaps in services would be adding additional days for shower and laundry services, also expanding the current services for a growing population of female clients, which we are seeing more into our community. So some of the proposed solutions could be to include collaboration and intentional sharing of information of clients that are being served with or by other social agencies, merging local initiatives with other service providers to prevent duplication of services to identical populations. How does that sound, Ms. Stephanie? That's where you are. Thank you. So not only the Savannah Baptist Center, we also did sharing another example of a community assessment with the Rape Crisis Center. The Rape Crisis Center provides domestic violence programs and interventions, as well as providing situations whereby advocacy as it relates to individuals who are suffering under the hand of domestic violence and abuse, as well as a collaboration with our young people on bullying initiatives. And again, I would not need to go through that, but that's simple asset form where we're able to share with our communities and our agencies. And again, many of your agencies may not have been assessed. And one of the reasons for being able to come together at such a quick time is to prepare to have that opportunity, to have that discussion and that dialogue, that if there's an agency that has not yet to be assessed or discussed, that we will be able to receive that type of information. I'm going to stop right now because I want to give opportunity to Ms. Arlene Davis to come. And during one of our assessments, she was more than gracious to sit down with me and have an opportunity to discuss the GEPRI program and to also help us understand the federal and state guidelines as it relates to housing, and that the desire that she also has in connecting with us. So if you have questions that you may need, if you can write them down, you have paper where you are. I'm going to allow Mrs. Davis to come, as we're going forth through time, along with the persons that she has brought with her. Let's give her a hand. We want to thank you.
Thank you, Dr. Lee. When Dr. Lee came by, I believe it was last week, to talk to me about the reentry program, it is something we're interested in, but let me tell you a little about the Housing Authority and the limitations we have and what we're able to do. We operate two programs that you're probably familiar with. Public housing, and those are the neighborhoods that we have throughout the city of Savannah. Yamacraw Village, Caton Homes and Fraser Homes on the west side, Wessels, Blackshear, Stillwell Towers, Single Family Homes, and Patterson Terrace on the east and south sides. We have some units in the redevelopment of the old garden homes and some in sustainable Fellwood. We manage a total of 1,514 units. Okay, that's public housing. We have 6,000 people on that waiting list. Then we have our very popular Section 8. And we provide housing assistance to families who qualify, who find a house, an apartment, townhouse in the private sector. And the lease is between the voucher holder and the property owner. The Housing Authority is not a party to that lease. We provide the payment. That's the difference in what the landlord is charging and what the family is able to pay. We have 12,700 people on that waiting list. So don't be discouraged, but I just wanted you to know that there are a lot of people in this community who have signed up to say that they need housing. Now currently we house the 1,514, and I think that's 3,600 people in our apartments. And in the Section 8 program, it's 3,400 vouchers, and we don't have any vacancies. Let me say that again. We don't have any vacancies. Now, the units that you see boarded, those are undergoing major rehab. And most of those have been assigned to families that are on the waiting list. So please, if you see a board, don't call and say, I know you have an opening because I saw. They're waiting for families to move in. When Dr. Lee came by and talked to me, I said, well, I think your best option for what you want to do would be the Section 8 program, not public housing. Because Section 8, the vouchers allow you to go into the community and find units where you want those leaving the transition center to live. So they would not be close to any of the things they shouldn't be near. If they shouldn't be near a school, if they shouldn't be near a bar, if they shouldn't be. Section 8 allows you to do that because you find a property owner who's willing to participate in the program. If they will sign the lease and all of the conditions, agree to the conditions, then the person can move in. We determine if they are income eligible. And I'll have Ms. Lynn Coleman, who is our Section 8 Director of
Housing choice voucher.
Housing, yes. Assisted housing, who will come up and explain more in detail about that. But we determine if they are income eligible, then we determine if their income, how much they can lease, the maximum price, and how much we will pay and what would be their share. What I suggested is that this committee make a request through HUD to, I think you said there was 6 families you were looking to work with? To start with. That the Housing Authority of Savannah be given a special allocation of 6 vouchers to be used specifically for those persons that you would refer to us. If they don't come, it's not there yet. But that's why I started out by saying that 12,700 people, 11,700 on that list. So they would never get through because that list is closed. But if there is a special allocation, it would be similar to our Shelter Plus Care program. And in Shelter Plus Care, if you are HIV positive, HIV AIDS, chronic mental illness, and substance abusers. So we have to have referrals from a social service agency that's working with those folks before they can come in. And then they are limited to that program. And they have to abide by the rules of that program, which means they have to be in touch with a counseling service, there has to be an assessment, and they have to be meeting their goals. If they don't do that, then they lose their place and that voucher becomes available for someone else. If they are a veteran, then we have some veteran vouchers, but they have to be referred to us through Veterans Administration. Okay, so you would want to fall into the category of the agency or the collaborative that would refer individuals to us. Then our role would be to inspect the property to make sure it's meeting the housing quality standards, to determine their eligibility, financial eligibility, and then to go out and do annual re-inspections to make sure the landlord is doing what they're supposed to do and that the property is being maintained in a safe and sanitary condition. So see, it wasn't all bad news. I don't come bearing the best news, but there is hope. With all these ministers in here, that's right, that's right. So, do you have any specific questions for me at this point? Oh, one other thing. If they are a registered sex offender, we cannot house them. Pardon? Ever. If they have been involved in the manufacture, sale, or distribution of methamphetamines, it's a lifetime prohibition. If they have been involved in, and this is coming from the federal government, not from the Housing Authority of Savannah. You can check this out. You can go to housing.gov, HUD.gov, and it's, what's the number? The PIH number 2003-11. Okay, it's right there. It's like a 4 or 5 page document explaining everything that the Housing Authority has to do. So, registered sex offender, lifetime prohibition, sale, distribution, or use of methamphetamines, lifetime prohibition. And if they lived in an assisted housing program before and they left owing money, they will not be rehoused until they pay what they owe. And if they left owing more than a certain dollar amount, we'll refer them to the DA for prosecution. Yes, ma'am.
Hi, I'm Lori Irish from the Coastal Jail Ministry of Georgia. On our transitional program, we try to keep them away from government assistance or permanent government assistance. So when they enter the shelter plus, that's permanent housing. If we get them a good job and they start working and making more money, they have to report that income and then pay accordingly?
Yes.
Okay, and the Section 8 as well?
Yes.
Because when we get them from jail and they go through our program, we get them fairly good jobs, we upgrade them jobs so that they can make their own way and have purpose in life and look to the Lord for help and depend on God and their ability to work and earn money just like they've always wanted to. They want purpose, they want to be able to take care of themselves. And we want their children to see mom and dad coming home from work and supporting themselves. So if we were to ask your agency for help to house them, how can we do it on a temporary basis so that when they're on their feet good enough that they can be released from that program and not lean and use that for a crutch?
Ours is not a program they would be released from. They would become eligible for the housing when whoever is managing that individual determines that they are eligible to go into the private market and have substantial enough income to pay all of their expenses. It's up to you.
Okay.
But there is no time limit.
Well, I'm not
once
looking for
they're-
a time limit.
But I'm just saying,
yeah.
it's not something you would be released from. When you determine that they're eligible in your minds to move, then that's the case plan that you would have for them and everybody else in that household who's at least 18.
Okay, thank you.
Yes, ma'am.
My name is Lois Nell with the Transitional Life Services. So are you saying the last statement about an individual who's a sex offender or on drugs, they cannot live in Section 8 or only in public housing?
They can't live in a federally assisted housing, period.
Even though it's Section 8? they
It
can't?
doesn't matter. If it's federally assisted, they can't live. We cannot approve them.
Okay, so even though the law may say that the sex offender, the case may be past 25 years, they
Doesn't
can live
matter.
anywhere, it still applies.
Then that's why I referred you to
And what's the number
HUD.gov.
again?
HUD.gov. What's the number?
You can also Google the One Strike You're Out policy implemented by President Bill Clinton in 1996 that clearly defines how it came about.
Yeah, when Dr. Lee came over, he said that people in different jurisdictions were saying, well, they have different policies or different procedures that they're following. And so he asked me to come in and tell you what's in the federal policy, the guidelines that we operate under as the Housing Authority, and that's why I gave you the HUD.gov website and the policy number so that you can go and read it. And there is some flexibility allowed to housing authorities, and it's clearly stated in our policy that if you were convicted of a felony, depending on what it is, we can deny you housing for up to 5 years, and if it's a misdemeanor, up to 3 years. Yes. Yes, sir.
You mentioned that you had 6 families that you were already.
No, I said that when Dr. Lee came to talk to me, he said that initially you would be looking to work with 6 families who would have been in the transition center, and now they're making the further transition to the community. That's where the 6 number came from.
Also, if I were a private owner, own some property, and I wanted to house ex-offenders, would the housing authority assist in making sure all of the codes and regulations were up to par?
The way
to
the-
make that happen?
The way the procedure would work, as it works with our other programs that have a finite number of vouchers for people with specific backgrounds, the referral would have to come through this group. They would have to have a case management plan. And one of the plans would be for them to live in housing outside of the transition center. Once that is the case, you would send them to us. We would determine that they are eligible. They would be issued a voucher. They would then go into the private rental community and find a place to live. We would send somebody out to inspect the property to make sure that it is meeting what HUD calls the housing quality standards. Then we would get with the landlord or the property owner and go through this long list of things that HUD requires that they sign, saying that they will, what they will and will not do. When the landlord signs that agreement, then they would sign a lease with the individual, and we would send something to the landlord letting them know the full rent and how much of that rent would be the responsibility of the housing authority and how much would be the responsibility of the individual or whoever would be paying it on their behalf. It's simple.
Just so many.
Yes. Was that another question?
Well, you mentioned about the drug exclusion. You mentioned specifically methamphetamine.
Because
it
that is
only
listed,
methamphetamine?
yes, it's just meth. That is listed specifically.
So any other drug is not necessarily restricted.
Right, but it also goes into detail that if someone had a drug problem, they would have to have completed a drug rehab program. So that would be a part of what the service that you all would be providing while they're in the transition center, correct? Yes, no? Yes, ma'am.
I'm just gonna ask this because I actually work for Warden Morales inside the prison system. And I was gonna definitely speak to Mr. Lee about this because we've started getting these intakes that are not transitional center inmates, that are getting out within 90 days, 120 days. So we've actually, at this point, since the last meeting, we've received about 24 inmates.
Right, that's starting to move, right.
So-
October the first is the first release date, the first set. And then we looked at for, November and December. So they're gonna have it, so there should be a designation, which we'll be doing in reach, there, for those who are GPRI, persons, so that in reach template is being developed.
Okay, we
for us
just
to come in
wanted,
to assess the needs.
okay, we just wanted, because we've told them that, you know, all these community resources are gonna be used to help them when
Correct.
they get out. And I have them stopping me on the flat top every day. And you just told me somebody, and I know it's a time process, but, you know,
Right.
Okay, and once again, you don't have these 6 vouchers yet. That request has to go to HUD because we don't have any. Okay, all right. Got that, Scully Red?
Yeah, I got it.
Okay. Any other questions?
Please.
No?
Any other agencies that have, because that was, for many agencies, that was one of the issues that we wanted to help alleviate. Mrs. Davis has answered many of our questions, because we have some agencies. Go ahead.
I could ask questions all day, so you're just going to have to say it's time to
Okay,
stop.
yeah, one more.
The restriction on the felony, 5 years, is
Yes.
it conviction date or end of sentence date? What is, you know, you say you can restrict them for 5 years. Is it from the conviction date, the date of release from prison, or?
I think it's the conviction, isn't it? Yeah, it's conviction date. Because you might do something and have some more time tacked on once you get in, right?
You might also get out of prison after 15 years, and it's been longer than 5 years since you've been.
And
convicted.
then we look, even if it's been 5 years, we look to see what the conviction was for. Now, if they murdered a spouse, we don't want them. I'll tell you right out. If you killed your spouse, then it might be a danger to some other people. We had a man who pistol whipped his wife. We did not house him, and I had to explain it to him. You pistol whipped the one you said you would love and cherish, and so you might get into it with your neighbors. And I'm sure Sergeant Famble, And Deputy Enoch don't want to keep responding to those kind of calls. So, yeah, some of them are judgment.
Also, if you're on probation, until that probation ends, you can't house.
What, say that again?
Probation.
Probation.
Okay, folks, okay, all right, hold up. When you request those 6 vouchers, you would have to put some stipulations on what you want to do and who will be responsible. Because the difference in being referred from this program is that they would have all of these services and supports surrounding them. Now, other folks just walk in off the street. Off the street. They make application and they may not have received any services, any counseling whatsoever. So that's a difference. When you request the 6, just like we do for Shelter Plus Care, if you have any of those, then you have to be involved with the social service agency receiving counseling. Because, you know, people who have mental illnesses, they start feeling better and they stop taking their medication. When they start to have issues, we need to be able to call somebody to come take care of it, because we're not mental health counselors. Yes, sir.
We'll take 2 more and then we'll go forward, please.
Yes, sir.
Submit the correct. Superintendent Wilcox was saying that when we submit the application to HUD, that community case management program would need to be in place, which is provided by the steering team.
You would stipulate that those persons referred to us for this program would have to come through you all, just as veterans have to come through VA. You had a question up here. Yes, sir.
You mentioned that you can deny federal services to convicted felons. You have the discretion.
Deny housing.
Deny housing, excuse me, to convicted felons. You have the discretion to do that.
Yes.
You just told a story about spousal abuse.
No, I said pistol whipping.
Pistol
It was
whipping.
more than spousal abuse.
Okay, do you have a codified list somewhere that you adhere to as far as this felony yes, this felony no? Or is that completely
Yes.
discretionary?
We have it?
It's on our website under what we call the ACOP, which is the acronym for the admissions.
And continued occupancy policy. And you can go to our website, our entire, but again, you would go for the admin plan, which is
For
Section
Section
8.
8.
ACOP is for public housing, you'd go to the admin plan
It can
for
get
Section 8.
confusing, we got 2 totally different plans that we have to.
Reverend
operate.
Tillman?
Right. So any of the present residents end up on probation, are they then?
If they're currently housed, but that's not who we're talking about here, but just in general. If they go to court and they're doing what the court says, they are not necessarily terminated. It just depends on what it was for. What generally happens is people are arrested, they don't tell us anything, and then we find out. But we still work with them. We try to have a plan for everyone who we house, for everyone in that household who is at least 18 years old. We have special grants called Resident ROSS. Resident Opportunities of Self-Sufficiency, Ross grants. And we have case managers assigned to those neighborhoods. And it's strictly voluntary. But we go in and encourage people to complete their GEDs if they didn't finish high school, to try to enroll in some of the certificate programs at Savannah Tech. We even have a GED program in our building at 1407 Wheaton Street. We have a homeownership program, and we have an early childhood program, and we have, what is it for the adults? The one that Annie does.
I know.
Yeah, we have one for adults also to increase their self-esteem.
I guess I was just basically asking if sometimes folks will go ahead and plead guilty to things.
That's first offender?
Right, no period, just they plead guilty, never done something else. To kind of move the process along. And if they've done that, I'm just saying, do you look at them case by case?
Yes.
Or if they've been convicted of a certain thing, then they're totally out? That's
If
all.
it's a felony, there probably will be, their lease will be terminated. Because they usually go, yeah. And if they're arrested and they're serving more than 6 months someplace, we can't keep their units for them
Or transfer it to someone.
or transfer it to somebody else.
Let's give Ms. Davis a hand. Thank you. Again, we are grateful, and our concern is that this has helped clear up a lot of misunderstanding that we've had in our community as it relates to housing. And this was the joy of being able to collaborate and go into our various agencies, because we get so much misinformation. And then we regurgitate that, we repeat that misinformation till we feel it becomes so. And so again, we're grateful for Ms. Davis. She and her staff will also be available after we've completed and again, housing director and
Section 8 public housing.
Section 8 and public housing. So if you have more specific things that you would like to share with them, they would be more than need. So as again, to reiterate what Mrs. Davis has stated, this program is so vital and important, and the collaboration with our steering team is vital, because as we are preparing our comprehensive plan will be able to be submitted to HUD to ask for their approval for those vouchers for Section 8. So it's important that as we go into our breakout groups, that we take an opportunity, and I will flip back to where we were as it relates to some of our community service providers and the area services that we are a part of. That the areas of service that we've been looking at, as I've mentioned many of those, and it's in your packet, but also as we look around the major areas, of course, of employment, of housing, as well as mentoring, whether it's mentoring through structured organizations or faith-based organizations, that those are some areas that are needed to make sure that we have ample providers. These providers also, even if they have been sharing services to reentry persons, we still need, and they've been servicing for a long time, we still need an opportunity to assess and vet the services, that as we apply for the initiative and the recommendation that Mrs. Davis has stated, that we have viable entities who are providing quality service. Just because you are a service provider does not necessarily mean that the service you provide is quality. And that is important as well, because we are not just desiring just to stick a group of individuals together, but we want to be able to have an opportunity to give the best that we have as a community to individuals, to provide them the best opportunity needed to be able to be successful and to decrease our recidivism rate in that. So as we prepare to get ready for our breakout sessions, question Dr. Eric Mason.
I think I need a little some clarity for the room.
Mm-hmm.
These are all agencies that we're talking about that's going to provide services.
That are currently providing services.
Okay.
Mm-hmm.
Now, are all of these services free services, or is there a cost? Because
both.
Okay, because
Both.
I think that's important to be understood, because
Mm-hmm.
if I need help and I'm without resources, finances, and I come and need these services, and I need a voucher, and I gotta have this in order to get that, and I don't have the resources, I'm still without. And I think we need to be established
Right.
that what agency is gonna offer free versus what agency is gonna be cost. Otherwise,
I agree.
people are thinking that we offer free service when that's not the case.
Mm-hmm. I agree, and you're absolutely right. And that is one of the reasons that when you look on your sheet, that you are saying, what is the cost? Is there a particular cost for those of you who have your community asset form? And if we don't have those, we'll get some more
I know
to
you're
you.
talking about the Baptist Center, where it was $1 for a shower.
Right,
If you need to
mhm.
do so forth. So those things need to be established, so that if we are sending as pastors or whoever, or
Mhm.
community people, lead people to these places, we need to prepare them. Okay, if you're going for this service, this is what it's gonna cost you to do that, or this is a free service, so you'll be able to go, so that they won't be running in circles and not have, the proper information needed.
Right, and as Dr. Mason has brought that up, so the goal is that as these agencies are being assessed, the agencies are now dumped into what we call a comprehensive plan for the entire community. This comprehensive plan goes over everything from the type of service that is provided to what the cost is to the client, to what necessary barriers or gaps that there may be. And so that's why it's important as you're discussing in your groups and as we are assessing and as you are helping us assess, to make sure those specifics, and many of you, we are appreciative of the information that you have given, because many times organizations do not desire, to share financial information. But again, it is important for us to understand what your needs are, where your funding comes from, so we can see what your capacity is to be able to service individuals. That your agency may not be able to service individuals who are returning citizens. Your agency may simply service individuals who may be homeless or a particular population, and that's wonderful. But so many times, as Dr. Mason said, we refer persons to agencies and we don't have all the information that is needed or necessary. So the goal through this initiative is from the top to the bottom, that we provide a comprehensive, extensive, intentional plan for Savannah that helps us understand our assets, our gaps, our barriers, as well as our proposed solutions. If we could take a moment to where you are, you should have in your packet, we're going to go back and look at a community asset form. We want to look at the 3 areas, whether we're dealing with employment, whether we're dealing with housing, we're dealing with mentoring/education. And we want to take a moment where you are, you have paper and pens galore. We're going to ask again, we're grateful to see our community co-chair, Dr. Maxine Bryant. Let's give her a hand. If you can stand, she just was able to come in as well. We're going to take a moment. We want to discuss where you are sitting in collaboration with your community asset form, which is here. You look at assets, barriers, gaps, and proposed solutions. As you take a moment to introduce yourselves, I'm going to move some individuals around because we don't want to have all law enforcement and all preachers. We got to mix this thing up. So we're going to ask Mr. Joe, if Mr. Joe will switch places with Dr. Mason. Thank you. Thank you, I appreciate it. We're going to ask Ms. Paula if she would come over and share over next to Ms. DeLetter. Yeah, Ms. Vetter, I'm sorry. You don't have to move. We're going to move. We're going to ask to come. And we're going to take a moment. Thank you. Excuse me. Sorry, Mr. James. right over here. We're going to ask Mr. Farrell, Bishop Farrell, if you would take a moment, and come up here to the front, and to share. We want to take a moment now. We want to put on the table employment. We want to discuss employment. That a couple of our service providers mentioned that many times individuals that are incarcerated, with their training, they choose either between education or employment, correct? And that is usually not both, it's either or. And the demands of employment are great for individuals that are coming back. Ms. Shalfala, some of the needs that, Mr. Wanda, some of the needs that individuals have when they're returning, when it deals with employment, one of the reasons needing employment, paying probation, parole costs, fees, what are some other things?
The probation and parole fees, whether it's that they have health issues or if they're mental health residents, they have to pay for those because they don't fit the sliding fee scale. Even just a place to stay, that's the biggest thing. A lot of the guys are really just, like you say, wanting to go back to school, but because they have to work, they can't do both. So it's either work or school.
So as we deal with, at your tables, again, we're going to ask someone.
And the child support.
And child support. And child support, which is very important. Where you are at the table, and again, Pastor Tillman, if you can engage this table as well. Again, we're grateful to see Mr. Scott West, sharing with us. He also is helping tremendously help us engage the workforce community. And so both of these tables will be engaged together. I'm asking someone at your table to serve as a scribe, meaning someone that's able to write down some of the comments that you're sharing. What are some of our assets? Do we have any?
Can I add something, please?
Yes.
Oftentimes we look at employment as the only option that the guys have. Many of them already have skills.
Right.
They are carpenters. They are.
So that's one of the assets that you would share, at your table.
But instead of looking at dealing with them from an entrepreneurial perspective, which in fact many of them have the ability to do and can deal with if they got the right support. Many, again, a lot of times it's not, I don't need money, I just need an opportunity to get
open door.
started so that I can go on. And that way, I'm not begging for a job. I'm actually just marketing my skills.
Right.
I think that's an important piece for us to start looking at, especially when guys are coming out. Because most of the times, they go back to doing what they had to do because they couldn't find a job.
Right, the recidivism rate, exactly. So as you share those at your table, again, I need you to discuss where you are right now. Take a moment to introduce yourselves. I can't introduce everybody myself. So everybody say how you doing, how your mama doing, how your daddy doing, how are you doing? Everybody take a moment to talk with each other. And as we deal with, let us deal with employment. Yeah. Okay. If there's someone at your table that will be able to write. Yes. Yeah, we're dealing specifically with Savannah, not statewide. But what are our issues?
I
Thank you.